The correct diagnosis of the dangerous mental illness called schizophrenia requires precision and a comprehensive approach. Psychiatrists take their time with this matter, as it is a lifelong sentence. Nevertheless, for the timely detection of the pathology and to seek help from a specialist, it is necessary to recognize its main signs. Only in this case can we talk about the appointment of adequate treatment. Previously, it was believed that the disease manifested through such mental factors as delusions or hallucinations, but this is not always the case. In fact, the first symptoms of the pathology may be any obvious mental disturbances, emotional disorders, fear, anxiety, etc. What should one rely on to determine the disease? How can the first symptoms be detected at the earliest stage? Which of them should we focus on? Proper early diagnosis determines competent and effective treatment. Let's go through the signs of schizophrenia in order. Emotional disturbances in the patient. The first manifestation of an emerging mental pathology in the patient is emotional degradation. This condition is the gradual weakening of emotions, primarily concerning close relatives, which cannot go unnoticed. Emotional dullness may be amplified by an inadequate reaction to events, phenomena, and people surrounding the patient. Emotional inadequacy is expressed in the glaring mismatch between the emotions displayed and the insignificant quality of the irritant. For example, the expression of unfounded anger, irritation, and aggressive behavior towards a wife, husband, parents, or children. At the same time, aggression is often not directed at people with whom the patient has no significant connections or close spiritual relationships. Attention should be paid to the patient's loss of all previously active interests, hobbies, and various activities, especially if they do not take up new interests. Typically, those suffering from schizophrenia are not engaged in anything and aimlessly walk or sit silently without purpose. A sign of the pathology is also a significant weakening of the sense of self-preservation. For example, this includes a reduced interest in the process of eating. Patients feel hunger, but, due to general lethargy and indifference to daily routines, skip meals, forget to comb their hair, bathe, wear dirty unwashed clothes, and fail to observe usual rules of decency. The family is the primary place where early signs of mental disorders, including schizophrenia, can be recognized. Be attentive. A problem is that in families where quarrels and aggression are the norm, it is difficult to recognize emotional dullness in time. Relatives usually become concerned only when the patient expresses strange ideas, engages in lively conversations with themselves, or with someone invisible. If a schizophrenic suddenly harms themselves or others with sharp, blunt, or heavy objects, close family members finally decide to seek help from psychiatrists. Yet, the nature of the disease could have been recognized earlier, thus avoiding danger. In families where relatives respect and love each other, the first signs of schizophrenia are noticed much earlier. This helps to begin the treatment process more quickly and effectively. Delusional ideas and hallucinations. However, it often happens the other way around. Emotional disturbances become noticeable only after the onset of the disease, and the first clear signs of schizophrenia are delusional ideas and various types of hallucinations. The main themes of delusional ideas are mysterious influences on the patient, various forms of persecution, and illogical, strange relationships. Delusional ideas of influence are expressed in the complete certainty of their reality. The patient endlessly bores others with stories of flying saucers, aliens, deadly rays, radioactive contamination, currents, waves, curses, and hexes. They find more and more new arguments and facts in the context of their main theory of negative influence by mysterious and dangerous forces. The character and theme of the patient's illusory stories depend on their environment, religious beliefs, education, and affiliation with a particular culture. If in the Middle Ages, a broad theme for delusions was witchcraft and religious intolerance, now it is cosmic and informational topics, and advancements in the latest technologies. Delusions based on fear of persecution can range from vague statements to quite specific fantastic stories with detailed elaboration and complexity. You may hear fascinating tales of secret societies, terrorist cells, and organizations that have tasked unknown people with eliminating the patient. Delusions of relationships are expressed in the schizophrenic's stories about their strange relationships with mysterious beings. Hallucinations, especially auditory verbal, manifest as voices giving absurd, dangerous commands and annoying internal commentary.